order. This morning, the Finance Committee examines the Change Healthcare hack that nearly brought our country's healthcare system to a standstill 6 weeks ago. Joining the committee is Mr. Andrew Wyden, the CEO of United Health Group. You'll hear them called UHG, and they own Change Healthcare. Let me put things in perspective. Last year, United Health Group generated $324 billion in revenue, making it the 5th largest company in the country. Overall, the company touches 152 million individuals across all lines of business: insurance, physician practice, home health, and pharmacy. With its profits, UHG has purchased dozens of other healthcare companies and is the largest purchaser of physician practices. This corporation is a healthcare leviathan. I believe the bigger the company, the bigger the responsibility to protect its systems from hackers. UHG was a big target long before it was hacked. The FBI says that the healthcare industry is the #1 target of ransomware. It is obvious why. Change Healthcare processes roughly 15 billion healthcare transactions annually, and 1/3 of Americans' patients' records pass through its digital doors. Change specializes in moving patient data from doctor's office to doctor's office, or to and from your insurance company. That means medical bills that are chock full of sensitive diagnoses, treatments, and medical histories that reveal everything from abortion to mental health disorders to diagnosis of cancer to sexually transmitted infections. Military personnel are included in this data, leaving this sensitive patient information vulnerable to hackers, whether criminals or a foreign government, is, in my view, as a member of the Senate Select Committee on Intelligence, a clear national security threat. I don't think it's a stretch that the impact here rivals the 2015 hack of government personnel data from the Office of Personnel Management. The FBI called that a treasure trove of counterintelligence information for foreign intelligence sources. United Health Group has not revealed how many patients' private medical records were stolen, how many providers went without reimbursement, and how many seniors were unable to pick up their prescriptions as a result of the hack. The failures of CEOs like Mr. Wyden, who months in can't figure out how many people have had their data stolen, validates the FBI warning. In the wake of this hack, United essentially disconnected Change from the rest of the healthcare system. It took weeks for Change to get back online, leaving healthcare providers all across the country, certainly in my home state of Oregon, in a state of financial bedlam. Doctors and hospitals went weeks delivering services but without getting paid. Insurance companies couldn't reimburse providers. Even today, key functions supporting plans and providers, including sending receipts for services that have been paid and the ability to reimburse patients for their out-of-pocket costs, are not back up and running. The small providers, particularly mental health providers, have been left holding the bag, stuffing envelopes with paper claims, and unable to get straight answers on how long this outage is going to last. And patients are bearing the brunt of it. Prescriptions went unfilled, patients were stuck at the hospital longer than needed, and Americans are still in the dark about how much of their sensitive information was stolen. The credit monitoring service Change is now offering is cold comfort to all of these frustrated patients across the land. The Change Healthcare hack is considered by many to be the biggest cybersecurity disruption to healthcare in American history. It is, in my view, Exhibit A that the country needs tough cybersecurity standards, and they're needed to protect critical infrastructure and patients across the country. The Health and Human Services Department doesn't require healthcare providers, payers, or healthcare clearinghouses like Change to meet minimum cybersecurity standards, unlike industries regulated by other federal agencies. Meeting a baseline of essential cybersecurity standards is a must. but it is meaningless without strong enforcement. Health and Human Services has not conducted a proactive cybersecurity audit in 7 years. As it stands, if a company doesn't comply with the relatively meager cybersecurity regulations, the fines amount to nothing more than a slap on the wrist. In my view, federal agencies need to fast-track new cybersecurity rules for Americans' private medical records, and the Congress needs to watchdog this every day to make sure that what is getting done is the essentials of protecting patient data. Finally, the Change hack is a dire warning about the consequences of too big to fail megacorporations gobbling up larger and larger shares of the healthcare system. It is long past time to do a comprehensive scrub of United Health's anti-competitive practices, which likely prolonged the fallout from the hack. For example, Change Healthcare's exclusive contracts prevented more than 1/3 of providers from switching clearinghouses, even though Change's systems were down for weeks. Accountability for Change Healthcare's failure starts at the top. Before this hearing, I asked the company which members of its board have cybersecurity expertise. UHG pointed to the NCAA president, Charlie Baker, who signed some technology-related legislation years ago when he was governor of Massachusetts. He certainly seems to be an expert on basketball, but UHG needs an actual cybersecurity expert on its board. Mr. Whitty owes Americans an explanation for how a company of UHG's size and importance failed to have multi-factor authentication on a server providing open-door access to protected health information, why its recovery plans were so woefully inadequate, and how long it's going to take to finally secure all of its systems. I hope that today's hearing can mark the beginning of a bipartisan effort here in the Finance Committee. That's what we've done on PBMs and a variety of other important issues. I encourage all the members of the committee on both sides of the aisle to focus on the subject in hand. That is because this is so important, it's so vital, and there's much to discuss.